Dear friends, colleagues, dignitaries, I am very happy to be amongst you today. Sapiens Health Foundation was started in the year 1997 with the idea of helping patients with kidney disease to subsidize dialysis and kidney transplantation. The word sapiens refers to wisdom. So what we found was we were able to help some patients, and I am sure Bharat and Umesh would agree with me. Somebody who gets a kidney failure, lands up on dialysis, undergoes transplantation, he ends up spending 35 to 40 lakhs in his lifetime, and of course has a suffering for him as well as his family. This money may be spent by him or by the government or by an organization. But anyhow, there's a big loss. So what is most important is prevention. Even a single case of renal disease, if we prevent, it has a meaning. So in 2005, the foundation, with the help of the Japanese, Professor Toma and Professor Tanabe, started the preventive program in and around Chennai. Japanese people are the world leaders in prevention of kidney disease. They have a mandatory screening of urine for albumin and RBCs in every school child every year. With this, they have been able to identify renal disease early, and they have been able to prevent people landing upon dialysis. So this is a program which we started in 2005 and started screening all the students in and around Chennai, and we have published this data in international journals and presented in the American Congress of Nephrology. Of course, the most important point, what I realized was, is the vascular damage. The underlying culprit of the non-communicable disease is damage to blood vessels. So increased heart attacks, strokes and kidney disease are due to salt intake. So that's the reason in 2010 we started the program on low salt campaign in this country. Initially, of course, we had a lot of posters, videos, lectures, talks and of interactions, etc. And in 2015, we got the Notable Achievement Award from the World Hypertension League for promoting low salt intake in India. This has been published in the Circulation Journal. And in 2017, we had the first Salt Congress that was held in both IIT Chennai and IIT Mumbai with Umesh Khanna in Mumbai, and with WASH, the World Action on Salt, Health and Sugar and Health. This is an organization from the UK which has been championing the cause of low salt intake. So this was a conference which was held in 2017 with Professor McGregor from the UK and Dr. Soumya Swaminathan from the WHO and the Public Health Department of Chennai. And subsequently we had a similar meeting again in Mumbai IIT also. And in recently we have started this program with the RTSL, Resolve to Save Lives, where we found that most important, the pillar of the community are the physicians. So physicians require more education on salt and health. Last week I was just talking to Vijay Kher. I was telling him a week back there was an interview with a famous cardiologist in Times of India, and he is talking about hypertension and its management. Of course, he emphasizes a lot on stress and de-stressing measures and a combination of medications to bring down the blood pressure. There is absolutely no mention of salt. So it is sad that physicians require first, even in MBBS, if you look at the program, there is hardly a discussion about salt. In the sense, there is a mention that reduce salt intake in case of high blood pressure, cardiac failure or renal disease. But what should be the intake? How much should we take? What are the sources of salt? What are the detrimental effects of salt? All these things are not really discussed. That is the purpose of today's workshop. I am sure with your cooperation and your participation, it would be a grand success. Thank you very much.